Last year, 64,000 people in the United States died from opioid overdoses, and the epidemic is only getting worse in Oklahoma. 6 months ago, a state commission began studying the problem, and this week it released a bold list of recommendations. But without public support and funding from the legislature, many of the directives may never be realized.
Led by Oklahoma Attorney General Mike Hunter, the 10-person commission on opioid abuse included people from law enforcement, the medical community, lawmakers, and other stakeholders. Their work has produced 31 recommendations to reduce an ever-increasing epidemic in Oklahoma.
In our state, over the last 15 years, drug overdose deaths have increased by 91% and continue to rise. Nearly 1,000 Oklahomans die per year due to drug overdoses.
Some of the recommendations don't have a price tag and just require legislative action.
We also believe that the trafficking of fentanyl and its equivalent must be criminalized. Currently, if a drug dealer is pulled over with a pound of fentanyl, there is nothing a law enforcement official can do.
But other recommendations will require action and funding. Commissioner of the Department of Mental Health and Substance Abuse Services, Terry White, says commissioners agree that a life-saving drug for those who overdose must be paid for and put in the hands of all first responders.
There is a recommendation to fully equip law enforcement with naloxone. There's a recommendation to fully expand drug court to the capacity and mental health courts to the capacity needed in the state, and to ensure that we invest in treatment.
Treatment for those addicted to opioids is one of their top priorities, and the commission wants lawmakers to enact taxation to pay for it.
The commission is recommending that the legislature enact a tax on manufacturers, wholesalers, and distributors of opioids, and use the money as a funding mechanism for opioid addiction treatment. Preliminary estimates on a proposed 10% tax could yield anywhere between $14.6 and $17 million a year in revenue for treatment.
Hunter concedes it may be an uphill battle.
I'm sure there'll be pushback, but we're prepared to be as confrontational as we need to be to get this done.
Another costly recommendation would mandate that all doctors discontinue handwritten prescriptions and use e-prescribing. John Scully is the director of the Oklahoma Bureau of Narcotics and Dangerous Drugs.
We investigate a lot of forged prescriptions. Pharmacists are handed forged prescriptions, and e-prescribing, if that takes place, then that should eliminate a lot of the forged prescriptions.
Skytook family physician Lane Sabera says as a commission member, he felt a duty to use e-prescribing because he knew they would be recommending the mandate.
For our practice, it costs about $30,000 just to put in the electronic software. And then we have additional fees on top of that we have to pay every year.
With the service, he can access a security code on his Apple Watch that changes every 30 seconds to e-prescribe a controlled drug.
They call that I think 3-part authentication, and what that does is that keeps an unscrupulous person from stealing my login ID.
Another recommendation asks for improved utilization of the Prescription Monitoring Program, or PMP. 2 years ago, lawmakers passed legislation requiring doctors to check the PMP online registry, which is updated by pharmacists every time a controlled drug prescription is filled.
So if a patient doctor shops, goes to multiple doctors, when the doctors check the PMP before prescribing certain medications, then they would be able to see that their patient may be doctor shopping, then they can have those conversations with that patient.
And while doctors can check on patient drug use, there is currently no way to digitally track doctors who are overprescribing.
It is a case where that one physician who is prescribing inappropriately or illegally, then that one physician could be a huge problem in the community that physician is operating in.
Scully says investigators rely on complaints against doctors.
If we get complaints or we receive information that a doctor is prescribing inappropriately, then we can obviously conduct an investigation. And sometimes, as Attorney General Hunter mentioned, it could result in criminal charges on a physician. We can also take administrative action on a physician who is prescribing inappropriately in violation of the prescribing rules.
At the national level, President Donald Trump has declared opioid abuse a public health emergency, but critics say there has been no funding to address the crisis. With Oklahoma's current budget shortfall, the same could very well hold true when it comes to funding many recommendations set forth by the Oklahoma Commission on Opioid Abuse.